Hi, I'm Dr. Chris Cimino, Vice President and Chief Medical Officer of Kaplan Test Prep Medical. I'm going to do a quick demo of our QBank and focus on strategies that we've added to our question explanations. So first, let's jump to the QBank. And first step, of course, is to create a quiz. I'm a neurologist, so I'm going to make it a little easier on myself and focus on just neurology. And I'm going to take all disciplines, and let's get rid of the easy questions. And finally, let's make this a short quiz. Actually, let's make this an untimed quiz because I'm going to be doing explanation. Don't want to run out of time while I'm talking. And finally, we'll make it a short quiz. I think about 5 items should be about right. And let's get started. I always tell students when they're looking at a question, start with the lead-in. That's the sentence or the question or the sentence fragment right before the answers, and then read the answer choices. You won't be able to answer the question, but when you read the vignette, you'll have a better idea of what to focus on. Let's read the lead-in first. Which of the following would most likely be secreted by these inflammatory cells? Well, we don't know which inflammatory cells we're talking about yet. However, we have a CAT scan, so good chance we're talking about microglia, but let's see. And the choices are immunoglobulin G, immunoglobulin M, interferon gamma, interleukin 10, transforming growth factor beta. So let's now what we have is that rephrasing of the question. What is the disease that causes an inflammatory reaction, and which inflammatory substance is being secreted? So a 35-year-old woman comes to the physician because of relapsing and remitting neurologic symptoms, including paresthesias, visual symptoms, and mild motor symptoms for the past 3 years. An MRI of the brain is shown. A biopsy of the lesion reveals the presence of CD4 positive cells in the perivascular region. Which of the following would most likely be secreted by these inflammatory cells? So the first thing you have to do is figure out the diagnosis. A lot of times people see CD4 and they think AIDS, but what we really have here is multiple areas of demyelination that is relapsing and remitting. AIDS conditions are almost never relapsing and remitting unless they're treated. But this is the classic presentation, in fact, the definition of multiple sclerosis. Multiple lesions that come and go and occur in different times in different locations. So now we've answered the first half of that question, what's the diagnosis? And now the question is, in multiple sclerosis, what is secreted by the inflammatory cells? And again, here you need to be clear on the different functions of each of these secretory substances. We can certainly easily eliminate some of them. IgG and IgM are reactions to infections. Interleukin 10 and transforming growth factor beta are at play in other immunologic situations. And interferon gamma is, in fact, the substance that is being released in multiple sclerosis. So let's go with answer C. Fortunately, we did very well. And let's review our questions and look at the individual explanations. This is our patient who has multiple sclerosis, and we want to think through the details of the immunologic reaction. There's the plaques that we're seeing is a loss of oligodendrocytes and myelin. The disease is initiated by CD4 Th1 lymphocytes that are reacting against some myelin antigen, and they secrete cytokines such as interferon gamma. And that activates the macrophages, which then attack the myelinating cells. So we would call this, in a sense, a type 4 hypersensitivity disease. The other choices certainly are seen in other diseases, just not multiple sclerosis. Immunoglobulin G can be elevated in multiple sclerosis. with the presence of oligoclonal bands, but it's not the primary hormonal reaction, immune reaction that's occurring. This question happens to have a strategy section, so let's go look at what that looks like. This is basically following the strategy I outlined, and they rephrase the question as what is most likely secreted by CD4 positive cells in this patient's brain lesion. The first step is still establishing the diagnosis, the age of the woman, the remitting and multifocal symptoms strongly suggest multiple sclerosis. The next step is considering the underlying mechanism of demyelination in MS and really understanding that it's T helper cells that are causing the reaction, and that then limits us to which kinds of substances we would expect to be released, interferon and interferon gamma specifically being the most likely. What about the other answer choices? As we said, IgG and IgM are produced by beta cell, B cells, and interleukin 10 and growth factor beta are also not really likely. They regulate and suppress immune response, if anything, and so that's not something we'd expect in an autoimmune inflammatory reaction. So all of this brings us back to the best answer being choice C. And that completes our review. As you can see, the summary also provides other information in terms of which organ system was tested and the disciplines that were tested and the level of difficulty. I hope you found this demonstration helpful.